You've probably all heard the tragic news of Wendy Williams recently. Frontotemporal dementia. What is this super uncommon form of dementia? What can you do to help prevent it? We're going to have a live Q&A at the end, and I want to make sure that we all learn from the legacy that she is leaving for us. Frontotemporal dementia does not have a cure. It's terminal in some senses. And Bruce Willis, Wendy Williams, it's not just famous people that can develop dementia. Unfortunately, when people develop frontotemporal dementia, they lose their careers, independence, and unfortunately, their very sense of self and their behaviors and their personalities change. What can we do to prevent ourselves? You're going to learn about frontotemporal dementia. We're going to talk about risk reduction strategies and why my patients have not heard of them. And first off, right off the bat, there is no definitive evidence for anything that will prevent frontotemporal dementia. But risk reduction is what nobody talks about, unfortunately, even though it is so important, especially for my patients who have multiple risk factors, so they can learn what to do to minimize that risk. The problem is that the ivory tower of medicine doesn't always address things that aren't going to generate money, not because medicine is bad or because medical schools are bad per se, but because of the unfortunate medical system that we live in, which is why I want you to be empowered with common sense strategies that are safe, that can reduce risks for healthier, longer lives. And this heart attack picture here is not just for randoms. It's because we don't look at prevention for other terminal types of illnesses, things that we cannot definitively prove. I can't prove to you that certain things are going to reduce and eliminate your risk of heart disease or cancer or autoimmune disease. We have very, very good evidence that has good data that shows a high likelihood, but nothing, including dementia, do we really have definitive evidence for. It's very, very rare. Doesn't mean that we shouldn't ignore the evidence for things like dementia, for risk reduction. After all, there wouldn't be any money if people actually talked about this, right? No, it's why we're talking about it today. So right off the bat, frontotemporal dementia is one form of dementia. It affects younger people more often. It affects compared to older people. So it's what we call an earlier onset of dementia. Anywhere from 2 to 10% of dementia cases are going to be from frontotemporal dementia, which is very different than Alzheimer's dementia, which is far more common, especially in older individuals. Whereas Alzheimer's, the hallmark is memory deficits. Of course, that eventually leads to death through involvement of other neurons, making it difficult to speak and eat and swallow. Speaking of dementia, I just realized that Karma here ate all of the cat's food because I forgot to put the gate up. So I don't know. I hope I'm not losing my marbles, but it sure feels like that sometimes. Gosh darn it. Anyways, back to frontotemporal dementia. I saw the dog with all the cat food all over her snout. If you want to see Karma or Mando, they're next to me. I can bring them in anytime on this live. But back to frontotemporal dementia, because the parts of the brain that Alzheimer's atrophies or destroys are different than the frontal and temporal lobes, meaning the front and side lobes of the brain that are atrophied and destroyed in frontotemporal dementia. These parts, when they're lost, lead to memory problems potentially, but more importantly, behavioral changes and language changes. We call aphasia one of the key deficits that will develop. Aphasia comes from Greek for a, meaning not, and phasia, speak. So like when we say atypical, meaning not typical, anemia, not enough hemoglobin in blood, anemia means blood. So aphasia means not being able to speak. So there's different variants of FTD where patients cannot speak because they lose the temporal lobes of their brain where speech is processed and produced. Now, the frontal lobe of the brain is where our executive function lives. So when we have individuals with frontal lobe damage, like strokes, or they have physical trauma to the frontal lobe, they, like patients with FTD, will develop this losses in inhibition. Wow, that did not come out right. Lose their inhibitions. So they become compulsive. they develop what's called hyperorality, meaning all sorts of gestures with their mouth, sucking, spitting, moving their tongue around like that, chewing, etc. There are also behavioral changes that come when the executive functioning parts of our brain are not functioning the way that they normally do. So, frontal lobe problems, which, by the way, anesthesia and many drugs of abuse will also disinhibit your frontal lobe. You can imagine how people's behaviors change under the influence of certain substances. Frontotemporal dementia is doing that with the frontal lobe changes, and the temporal lobe changes with the language or the aphasia that we talked about. If we want to know how to reduce the risk, we have to zoom out first to look at dementia as a whole leads to tissue destruction and toxic molecules being deposited throughout the brain, which can lead to that tissue destruction. So therefore, the common sense strategies that I advocate for my patients, even if we don't have full, definitive, compulsive proof that these are going to absolutely prevent dementia, because that might take lifetimes to fully prove with the appropriate studies, are to look at what strategies do we know can cause tissue damage in the brain. So it stands to reason, not by any leap of logic or faith here, that if we can perhaps address things that are known to cause brain tissue damage, we can hopefully reduce the risk of at least exacerbating dementia if you have the genes or other risk factors for it. So number one are anything that will predispose to stroke. When you have a stroke, you have a blood clot in the brain. Blood cannot flow past that blood clot. When blood cannot flow past that blood clot, tissue downstream of that blood clot will die because it doesn't get enough oxygen, glucose, and other important nutrients. So stroke causes brain tissue death. That will likely exacerbate dementia or predispose to dementia. Therefore, anything that can reduce the risk of stroke is going to be a prime target for reducing the risk of dementia, Alzheimer's dementia or frontotemporal dementia. We know that diabetes increases the risk of stroke. We know that heart disease absolutely increases the risk of stroke. Therefore, strategies that reduce diabetes and heart disease are no-brainers for any individuals who are at risk. At risk means the risk factors that I'm going to share with you just now, but also a family history of dementia, especially frontotemporal dementia. A sizable number of individuals with frontotemporal dementia have a first-degree blood relative with frontotemporal dementia. The second category of common sense strategies are to look at what can destroy neurons. Even if it's not a stroke, many other things can detach neurons from each other and cause neuronal damage. Alcoholism, no question at all, will destroy and atrophy your frontal lobe. That's adding insult to injury in the case of frontotemporal dementia. Traumatic brain injury, TBI, any type of head trauma can absolutely predispose to multiple conditions, cognitive impairment and dementia being just one of them, mental health and depression, PTSD being others. And then there's inflammation or autoimmune disease, why I called it autoinflammation. These can absolutely release inflammatory markers that can go all over your brain. They cross the blood-brain barrier and can damage tissue. Let's look at long COVID, for example, right? How much brain fog, not quite dementia, but cognitive impairment comes from what we believe to be at least in part due to neuroinflammation. Next, what are things that can contribute to cognitive impairment, even if we have not yet shown that they directly reduce or destroy neurons or destroy brain tissue? We know that cognitive impairment can come from social disengagement, no questions. In fact, individuals who are deaf are at a higher risk of developing cognitive impairment. By the way, for those of you who wanted to see Karma, she's right here next to me, and dogs absolutely can have an impact on heart disease. Here's the troublemaker that ate my sandwich earlier today. It was a very expensive $12 croissant from a San Francisco bakery. I mean, the epitome of like gentrified elite croissants. It was unbelievable. Anyways, moving on, right? I think I'm losing my mind having this dog sometimes, but dogs actually can be a powerful non-medication way of reducing the risk of heart attacks and strokes. But back to hearing aids and deafness. Individuals who are deaf have a higher risk of developing cognitive impairment. You can imagine the social disengagement, the reduced activation of the auditory processing parts of the brain. After all, if you don't use it, you'll lose it, is what we say. Hearing aids are a no-brainer for individuals who have hearing loss to help reduce the risk of that progressing to cognitive impairment. Now we have depression and anxiety, and these are fascinating. Alzheimer's dementia is individuals who have Alzheimer's dementia are more likely to have had depression in the past compared to healthy controls. Individuals who have frontotemporal dementia are more likely to have had anxiety compared to healthy controls. We don't know if this is associative or causative, but it is intriguing, perhaps because individuals who have anxiety are more likely to take medications like benzodiazepines, alprazolam, Xanax, Ativan or lorazepam, Valium or diazepam. All these medications are given out, unfortunately, way too often in the United States, at least, and likely have long-term effects if taken for indeterminate amounts of time in individuals who have anxiety. Whether benzodiazepines lead to frontotemporal dementia, we don't know, but you got to wonder, is this a compounding factor or a confounder? Does the social disengagement from untreated mental health conditions predispose to frontotemporal dementia? Possibly, we don't know, but it's not going to help if we're not addressing the mental health. It's believed that perhaps apolipoprotein E, which is the result of a mutation that individuals who have apolipoprotein E are at a much higher risk of developing dementia. Chris Hemsworth, whom I did a video on recently, has apolipoprotein E. That's why he is so adamant on reducing his risks for developing dementia. I had some hair in my mouth from when I picked up karma. I'm so sorry about that. So moving on about empowerment versus victimization. It's very easy when somebody has a history of dementia to feel like maybe they're a victim. Maybe they've had traumatic brain injury in the past. They've had multiple concussions. It's so easy to feel like we've lost hope and lost the ability to retake control of other risk factors that we can reduce. More empowerment, even if we have not yet shown definitively what the mechanism is that reduces the risk or prevents it altogether, should not get in the way of you taking advantage of these common sense strategies that don't involve more money to reduce your risks. Risk reduction might not be 100% prevention, but don't let better be the enemy of good. Don't let enemy be, it's a tongue twister. Don't let better be the enemy of good. Right? So if you're learning something, by the way, you hit that like button. I want to tell you about those risk reduction strategies in just a moment in terms of vitamins, etc. If you're learning something new, share what you've learned with your loved ones. Help them be empowered. And you can always join our exclusive access. The link is below to get access to our Zooms where you can more individually ask your questions. We go through all your questions, unlike here where there's hundreds of people watching. But let's talk about the specific strategies that have at least some good evidence behind them. Vitamin D, if it is deficient, there is not really a good reason to remain deficient in vitamin D, whether it's for heart health, for mental health, or for cognitive impairment. We want to replete vitamin D under the direction of your physician, hopefully guided by blood tests. Hearing aids, we talked about. Physical activity, no question. There's guidelines from every person under the sun, but you want about 75 minutes of high intensity activity a week or 150 minutes of moderate intensity activity a week. Pretty much non-negotiable. Then there's the Mediterranean diet. This is fascinating because it is so easy to implement. And really, if I had to boil this down to my patients, when I do, just avoid processed, refined foods. That is 95%, or at least 90% of getting the Mediterranean diet there. We know this can improve the risk profile for heart disease. We know that reducing heart disease can reduce the risk of stroke. I don't need another study to show that Mediterranean diet is at least worthwhile to consider in someone at risk of developing dementia. Mental health, we already talked about: depression, anxiety, loneliness, disengaging socially. We need to reduce the stigma around this, and you need to speak up for yourself to address the root causes of your mental health concerns and feeling stuck. Like Leonardo da Vinci says, stagnant water putrefies. Iron in disuse turns to rust. Our intellects will erode if we don't use them either. Now, I already said the enemy of good is better. Let's not let a search for definitive treatments or definitive risk reduction, expensive pursuits, get in the way of us implementing these common sense, cheap, safe risk reduction strategies that will not only impact our risk reduction for cognitive impairment, but also risk reduction for heart disease, possibly for autoimmune disease, for cancer, for our mental health. The beauty of addressing the root cause is that it affects numerous other health processes. Its fingers are not just in one organ, it's all across your whole body. After all, your whole body is connected. Every organ talks to itself, talks to each other. Wouldn't it make sense that addressing the root cause of your brain health is going to affect your kidney health as well? It absolutely will. So with that said, if you learned something new, please share with others. I want to answer your questions. There's so many great comments in here. Linda wants to see the cat and dog. I still have a little bit of hair in my mouth from Karma. I'll show her again when she walks this way. And Mando is perched up on his tree, but I'll grab him as well. Thank you, Heidi, for the reminder. Deborah, I'm so sorry about losing your mom in March. And I wonder what it was. I must have missed what came up earlier about your mom, but we know that grief can predispose to major depressive disorder without the right internal and external support. And we know that major depressive disorder has a long-term hit, perhaps permanent, on our memory and our IQ. Catherine, so good to see your comment. It can't get it to show up, but it says that you had surgery today. You're at home recovering. It is so good to see you as well, Catherine. I'm wishing you the best in recovery. I hope everyone else here is also wishing you the best. I just can't get your comment to come up on the screen. Oh, here it is. Great. Wishing you the best. Thank you for the kind super thanks. Patricia, I'm sorry that your mother has dementia. I hope that you can take these risk reduction strategies to heart, no pun intended, to advocate for yourself and to help reduce your risk of developing dementia. I also had anesthesia. Propofol works wonders. Yes, it does. Deborah, you are so welcome. And okay, Karma, come here. Everyone wants to see you one more time. Come on. Yeah, here she comes. These are no treats for this doggy. She's coming out of love for you guys. All right? Let's see you. All right. Here's Karma. She is so thrilled to see you all. Looking at the camera there, huh? Hi. All right. All right, let's put you back. Cindy's asking a good question about multiple anesthetics. If you have a lot of anesthesia from a lot of surgeries, can that increase the risk of your chances of dementia? Possibly. We don't have any definitive evidence to demonstrate that. So if one needs surgery, there are other risk reduction strategies that we can employ to reduce the risk of post-operative cognitive impairment rather than ignoring surgery altogether or putting it off. Thank you, Teresa. Deborah. Byzantine, any particular supplements to reduce risk? Vitamin D is important to test. Ginkgo has so much layperson anecdotal talk about it, has not borne out in studies. Statins have not particularly helped. St. John's wort can absolutely help with depression. Helping depression can help, at least we believe, reduce the risk of dementia. But St. John's wort, you need to discuss with your doctor. While it is very effective, it interacts with many, many medications as well. You don't want to mess up your other medications when you take St. John's wort. I'm so happy that you're feeling supported, Catherine. Holly's 12-year-old daughter is having knee surgery on Thursday, and you're so nervous. Any advice? Holly, I have tons of videos on preparing for surgery. I'm wishing you or your daughter the best, and you, of course, with your nerves. You can check out those videos. I hope they're helpful for you. Do I know anything about PVL? Please spell out that acronym, Mia. Everyone that has dementia is pre-diabetic, but being a pre-diabetic doesn't mean you'll get dementia. Well, not everyone who gets dementia is pre-diabetic, but likely a very large number. I'm with you on that. Um, Thank you, Emily. Mama Bear, well, that's very kind of you. Thank you so much. I hope that you can take this straightforward knowledge and advocate for others as well. Does it sound more likely that Wendy actually has alcohol-related brain damage? Well, alcohol is an absolute known tissue damage agent in the brain. It will destroy your frontal lobe. Will it predispose to FTD? A lot of people think so. I'm not aware of definitive evidence for this, but so much concern and plausibility that if someone's at risk for developing FTD, I would not touch alcohol with a 9-foot pole. Very, very good question. I know Wendy Williams' son has said that. How much do we need a daily vitamin D? Depends on your vitamin D blood levels. Vitamin D is fat soluble. If you take too much vitamin D, it will store up in the fat mass of your body. You cannot pee it out like vitamin B, etc. The doggy desperately wants to leave my room. I'm going to open the door and be right back. I gotta let her out. Oh, one more animal here. This is Mando, short for Mandalorian. He'll hang out here for a couple minutes. Benzodiazepines are like alcohol in pill form. Michelle, you're right that both are potent GABA agonists, which is why when individuals are detoxing off of alcohol, they want to quit. We do not want them to be taking other GABA agonists like Ambien or benzodiazepines. This cat, by the way, is like a dog. He looks at me nonstop. My wife calls him our Latin lover here. Pets cat over the internet. You're right. Can insomnia exacerbate the symptoms for someone who may have suffered from dementia? Yes, absolutely, because we know that individuals who have dementia are at a higher risk of developing depression. We know that depression can lead to stuckness. When we are stuck, it's not only being stuck like someone who's an alcoholic is stuck, but we can be stuck with our mind racing, keeping us up at 2 in the morning, 3 in the morning. Many individuals whom we label as insomniatics or insomniacs may actually have depression, keeping them stuck in that loop in the middle of the night. So we do them a disservice by not recognizing the diagnosis of depression and instead diagnosing them with a symptom. I'm saying insomnia is often a symptom, not always a diagnosis. All right, so Mando is going to say bye-bye to everyone. Yeah, all right. I'm going to put this little guy down. He says hi back to you, by the way. I am wishing you the best, Anne, for your lymphdectomy. I can't give you any specific advice, but I can certainly recommend that you speak with your doctor and maybe watch my videos to help empower yourself so you can better advocate. I had a drug complications with 3 days of insomnia. Michelle, we know that steroids are common culprits for insomnia, many other medications as well. I'm so happy that you've gotten over that. Someone had asked me earlier about PPIs. Can they lead to dementia? Ines, not that I'm aware of, though PPIs used chronically can lead to other vitamin deficiencies that are not going to do your body any favors, which is why we want to minimize the use of external medications, especially for conditions that can have natural therapies, especially acid reflux, which is heavily influenced by our mindset, by the foods we eat, and our physical activity. Adopt a pit bull. Everything is a risk versus benefit. Everything. Very, very well said. The licking is cute. It's a very rough tongue as well, by the way. We talked about this one. Somebody asked about vitamin D, and I didn't get to answer it. I typically would not, I don't recommend my patients to ever go above 2,000 international units or IU a day, unless they have a blood test result that informs or justifies a higher dose. That being said, you need to talk with your doctor. This is not medical advice. You have to talk with your doctor about what they recommend. I'm just sharing what I tell my patients. Anne was diagnosed with MG or myasthenia gravis. I'm sorry to hear about that. I hope that you are able to find a regimen with your anticholinergics and procholinergics, more importantly, too. write out your symptoms or minimize the symptoms. I'm so sorry, Anne, to hear about that. I hope everyone here um, is sending you positive vibes. So many questions to catch up with. Your Maine Coon rips your skin apart. Black, yes, Mando is a Maine Coon. You're right. That's very, very kind. Thank you, Marianne Hope. And Brenda, I'm happy I got to your question about vitamin D. Maine Coons are like dogs. You are correct, Michelle. And PPIs lower the acid in your stomach. The concern there is that if you lower the acid, what is the unintended consequence? Are you developing malabsorption? Are certain bacteria species more likely to grow at a higher pH? Right? These are all questions we need to know when we're talking about PPIs for extended periods of time, at least if there are other safer alternatives. Vitamin D2 comes in much higher doses than vitamin D3, so perhaps that's why. And Megan, you are so welcome. And I'm also very sorry to hear about Wendy Williams. So let's please use her legacy to help minimize the suffering of others. And we'll end with Jody. Had a mini stroke back in April. Last 3 months, I feel like I'm not thinking as clearly, as quickly as my memory is getting worse. Jody, I'm so sorry to hear that. Vascular dementia is absolutely a known phenomenon. It's one of the most common forms of dementia that happens when a stroke leads to tissue destruction downstream of the blockage. This is why anything that can reduce our risk of stroke is also going to be important in reducing the risk of dementia. I hope that you can find the right support to reduce your other risk factors so that your vascular dementia is not worsened, or other form of dementia if that is what your doctors diagnosed you with. I'll actually end with this one. Can marijuana lead to increased risk of dementia? Not that I'm aware of, but marijuana can lead to other conditions like perhaps anxiety. We'll do a whole video on that one, the relationship. It's really complicated about marijuana and anxiety. And anxiety itself does not do your brain any favors, especially given the increased prevalence of anxiety in those who are diagnosed with frontotemporal dementia. So, with that being said, you all have so much power over your health, probably more than you've ever been told. I hope that you all learned something new. If you did, hit that like button, share what you learned with others. Consider joining the exclusive access to come into our private Zooms. And I can't wait to see you all in our next stream. Until next time.